Parliament has reconvened, and one of the key issues was to listen to the Leader of Opposition statement on the President's State of the Nation address and to move a motion for Parliament to record its thanks for the clear and precise exposition of government policy contained in the address delivered on 6 June 2024. In his communication to the House, Deputy Speaker Thomas Tayebwa mentioned that he has received several complaints from medical intern students regarding their non-deployment. He emphasized that this issue recurs year after year, whereas it is known as prevalent in other professional bodies.
If you're telling these interns that you're giving them another year at home, without anything, I've done my part, I've finished the studying, but you are saying I cannot practice until I do internship. But then you're not taking me for internship. For health, on Tuesday brings a statement about this issue. I forwarded to her some of the issues which they raised in their petition, so that we come here, we give it enough time, and we ensure it is sorted for once and for all.
While presenting a statement from the opposition responding to the State of the Nation address by the President on 6 June 2024, the Leader of Opposition, Ruth Aceng, stressed that the government needs to prioritize the deployment of intern doctors
and retaining healthcare professionals. Accordingly, the government should increase funding for medical education, offering scholarships and incentives for students to study medicine and nursing, and providing competitive salaries and benefits to attract and retain skilled healthcare workers. Interns were protesting the other day. They are saying, we have studied for 5 years. Deploy us so that we can work. Is government listening?
Some members of Parliament who sit on the Health Committee attribute the problem of medical interns to the lack of regulation by the National Council for Education in training doctors in medical schools.
There need to have control of numbers of trainees, control of numbers who are entering into internship. Otherwise, if there is no control, there is no budget for that. And we shall continue to raise these issues on and on.
The medical schools, the universities which overtrain people are not regulated. We are going to have problems. But even then, there are not so many.
We need to engage with the National Council of Higher Learning such that we introduce a fixed number of medical students that all universities should handle in a particular year.
The Ministry of Health issued a list of medical interns who need to be deployed, and the committee is now tasking with ascertaining the cause of the delay in this deployment.
The Ministry of Health has issued a list of about 1,260 who should get deployed. And the situation seems to have so many more interns that actually need to be deployed. So we are yet to have a conversation with the Ministry of Health to ascertain what is limiting the list they put out. Is it to do with the internship centers or the money?
Members also noted that the President has proposed to give each medical intern 2.5 million Ugandan shillings, but this amount was reduced to 1 million. However, the challenge lies with certain universities that remain untouchable.
There was a proposal by President Museveni that interns could get 2.5 million, but this was so colossal, given their numbers. The numbers were so big, and government could not fathom that kind of a bill.
Even then, there are universities which are untouchable. When they tell them to train 100 doctors, they train 600. Actually, their salary is supposed to be 2.5 million per intern. Why should they be paid? Because unlike other professions, this internship is working internship. Actually, they do the donkey work in hospitals where they are posted.
I'm Nafka Farida and Gloria Gwitabinji at Parliament.